And right now at 10 o'clock, a state House committee will not take up an amendment to pause changes to a Medicaid program.
The program allows parents to be paid to be caregivers for their sick children. News 8's Danielle Zukoski spoke to a family on the west side of Indianapolis to see how this decision is going to impact them. Danielle.
Currently, Indiana families with sick children can apply to become their child's paid caretakers and are then trained and employed through an agency. This is funded through Family and Social Services Administration using Medicaid dollars. Now, this program is set to be scaled back to fix a projected budget deficit, and families are upset, saying this will leave many to make impossible choices.
Olivia Ruzick has a medically fragile 3-year-old son. With 27 diagnoses, all stemming from a genetic disorder, he needs round-the-clock care. She says if the attendant caregiver program is scaled back, and she and her husband are no longer paid an hourly wage to stay home with their child, she fears she will not be able to find a nurse to help with care when one of them starts working outside of the home.
You can either switch to a daily stipend of $50 a day, under something called structured family caregiving, or you can transition your child's care to another nurse or another attendant care worker, but the problem is there are no other workers.
Ruzick says her caseworker recommended 80 hours of paid caretaker time, and the Family and Social Services Administration, the agency also called FSSA, approved it. She says there were no safeguards at the state level to cap hours or thoroughly screen who was approved for the program.
We had no idea as families, and neither did the agencies that hired us, that FSSA was auto-approving hours. Now they're saying that families, are abusing the system, or that agencies approve those hours, when really it was their mismanagement.
Ruzick understands the need for fiscal responsibility, but says if families are forced off of this program, they could use Medicaid to fund in-home nurses who will likely be paid at a higher hourly rate than her and her husband. And some families might be forced to institutionalize their child.
And it saves them a lot of money because a nurse makes $30, $35, $40 an hour, and I'm only making, $14 an hour.
Ruzick says at-home care has kept her son healthy. With an autoimmune disorder, a constant rotation of nurses, and germs from other homes kept her son in the hospital. Now he is healthier, and his mom says he's using less Medicaid dollars by staying out of the hospital.
Republican Lieutenant Governor Suzanne Crouch is asking for answers from FSSA, including if there are enough caretakers for pediatric patients and if a tier system has been considered. Many Democrats are against the change as well. I'm Danielle Zukoski for Wish TV, wishtv.com, and follow us on Facebook for updates.
All right, Danielle, thank you very much.